everybody. We really are very happy to be here to be able to talk about this topic. I think it's very relevant at the moment with the amount of research that is happening for the COVID pandemic. And so I really hope that you enjoy listening to us and that maybe you learn something from our seminar. Today we're going to be talking about the Research Fairness Initiative, which is an initiative that CORED in Geneva put together through global consultation. We started in about 2016, I think, and we've been going until now. And basically, the Research Fairness Initiative is essentially a tool that we have developed to help institutions to kind of navigate partnerships and try to make sure that they are more equitable and fair. So it's myself, Kirsty Kaiser, that will be talking today, as well as Carl, who is our Executive Director at CORED. And so, Carl, are you happy to take it away? You can go to the next slide, Kuku.
Okay. So for me, thanks very much to Kuku and to PASA for inviting me to the webinar. I see there are some familiar faces like Elise and Eric and others who I left, if you want, when I left the University of Pretoria in 2004 to join CORED. And I'm glad to be back. And I think just prior to this meeting, we spoke to Kuku about actually one of the benefits of the COVID epidemic is that we've swapped flying with seminars, and in fact I'm meeting people across the globe that in the past you couldn't get to because it was so difficult or expensive to fly. So we're very happy to do that, and perhaps we can do a bit more often. So today on the Research Fairness Initiative, the idea is to bring across to you what it aims to do, what it can do, what it should do, and that COVID-19 clinical research is a key part in making this happen now. Also, you will hear from Kirsty a bit later that there are already South African institutions that have teamed up. We did notify the University of Pretoria, and they haven't picked it up, but we hope perhaps that this seminar might create a re-incentive to reconsider, because we really believe that, and the more people use it, the more we can make research partnerships across the globe equitable. And secondly, one of the reasons of doing that is that systematic capacity building in low middle income countries is clearly so important in order to deal with issues like COVID-19 and others. So that's what we hope to show you. I'll give a brief introduction that is more generic, and then Kuku Agekirsti will talk to you about what we've been doing so far, what is the practice, what is the RFI, what is involved. And at the end, there will be time for questions, I think, for everybody. So this first slide before is an article in The Lancet that came out in April that looked at, the COVID-19 is very important. We need to get to a global coalition if we want to really make impact. And then in fact, we're going to create this particular commentary led to a lot of organizations signing up to help clinical research in resource limited settings. And I think much of Africa would fall in there, and that this would in principle sound very important. Say, well, we have this thing, let's go global and let's work together to do that. However, if you then go a bit further, and that is the next item, thanks, Kuku, is what they're proposing is to facilitate COVID-19 research in low middle income countries by identifying and supporting established local investigators, local manufacturers, clinical trial sites, etc. What they're trying to do is that they're looking at successful research sites, and then let's work together. So this is, although it's called research in low middle income countries, basically it is kind of product-oriented research. We want a vaccine. And secondly, let's collaborate as far as we can go, as much as possible. That is the message out of this. The next slide, please, Kuku. If you then, at the same time, look at a Scopus mapping of where the research connections and the research collaborations are, you see a pattern that can be drawn into many areas, many topics, many research items in environmental, in all kind of research that is vaccine or clinical. And it is that you see that the major connections are between the East, Europe, and the United States, with a few down points going to Africa, Latin America, and maybe the Indian subcontinent. Of course, now 3 months further, this picture would be a bit more busy, but the principle would be the same. That actually there is very little research happening on the continent, and it is of course not a surprise if you then say, well, what we need is we are focused on research that focuses on vaccine development, that is high-level research for which you need high-quality labs and substantial financial infrastructure to do that. At the same time, the same picture could have been drawn in 1976 around Ebola virus. It could have been the 10 years ago Ebola virus. It could have been in many areas where it happens, and it keeps happening. And so the message that we're trying to say, there is a vicious cycle or a virtuous cycle, that if you spend time on serious research collaboration and research partnerships so that you build the capability of institutions, not just of good people, but of institutions to handle this and of systems to do the financing, to go the communications, etc., so then maybe you can start changing this picture more rapidly. And that is what the RFI tries to do, is say, well, if we get equitable and fair partnerships, then it would mean that technology transfer, all kind of other things become far more relevant and become part of the collaboration, not just an ad hoc notification, but a systemic change. So that's what we're trying to do with the RFI. The next slide will bring that a bit more home, and to say why is it important to have other research capacity, so in continuous research capacity going on in a country. And we felt in CORAD that basically the kind of the product-oriented, vaccine-oriented research is important, but it doesn't deal with many of the issues that affect low middle income countries, those low middle income settings. So whereas the Lancet article focuses on collaboration around vaccine development and the excellence that is needed for that, maybe there is also other research needed. And this last slide from the BBC on coronavirus in South Africa was a report, I think, about 2 days ago, that shows what we all know, and that is the health system is overwhelmed. And in a way, I speak about it in the South African context as we had an epidemic 1 and an epidemic 2. Epidemic 1 was a colleague of mine, Gita Ramji, who came back from a London meeting as an AIDS researcher from longstanding. We were great colleagues, and it was a kind of shock that at the end of March she died from coronavirus, and it set the tone for I think corona epidemic control in the country, which says, well, it is like middle class people coming back, there is money, it's not there where there are no means, no resources, where there is no water and no potential for social distancing. And so the epidemic 2, as I call it in inverted commas, is what is happening in slides like this, where the system is totally overwhelmed. So as CORAD, we propose to say, let's start looking at how can research capacity deal with COVID prevention and COVID management in areas where that traditional, i.e. the vaccine research is not there. If we would have areas where, what can we do? Is hand washing with used water also good? How can you social distance in Khayelitsha? How can you use research in order to find perhaps other ways to make alcohol available? Or what do we do with masks, and how can you improve systems in areas? That kind of research is equally important to deal with epidemic 2, which is arguably going to be the most impact in low middle income countries anywhere, not just in South Africa. And so that is what we're trying to do, and say research capacity is not just about high-end vaccine research, but the research capacity that you can build by being partners in vaccine research can also be used to deal with local priorities and local technologies. And so that's what the RFI, if you want, the ultimate purpose is to help all countries to use and to build their research system so they can guide, they can deal with the key issues that research needs to address for for problems in countries and in regions. The next slide, I think, then goes over to Kirsti, so who will talk to you a bit about more the practical implementation of this.
Thanks, Carl. So these quotes that are listed on the slide were actually in the Lancet towards the end of last year. And this article mentioned the Research Fairness Initiative, and it just spoke to the fact that the inequities in global health research are there, and everybody knows that they are there. But the problem is trying to deal with these inequities is a difficult thing to do, because it's not quite that straightforward. How do we go about doing this? How do we make sure that we are working towards more fairness and more equity? And so from our perspective, I believe that there are two ways to, no, that's fine, Kuku, you could go to that slide, yeah. We believe that there are basically two ways to actually creating sustainable research systems. The first is to use funding from the government or national funding, making sure that it's a priority, that research capacity is built. And that's pretty straightforward. It's quite a straightforward way of doing things. You can make sure that it's a priority every time the budget gets done, etc. The second way is through partnerships. Now, partnerships are much less straightforward. They are kind of have a stop-start nature, and they are not something that one can rely on as a consistent way towards building national research capacity, or at least in the way that they are currently handled. So what the RFI essentially does is tries to smooth out this process and make it easier for institutions to work towards building up their own systems over time. You can go to the next slide. So the RFI essentially works on a basis of it being an institutional reporting system that helps institutions to learn about what they are actually doing when it comes to research partnerships, how they deal with partnerships, as well as what is missing, whether there are any gaps, whether there are areas where they need to work on improving certain policies or practices, etc. So it works off three domains. We have domain, which is fairness of opportunity, which is everything that happens before you even begin your research. So that has to do with things like priority settings, early engagement of partners, dealing with financing, etc. The second domain is fair process, which is everything that happens during the research process. So this has to do with data management, employing staff, etc. And then the third domain is everything that happens as a result of the research. So things like publishing, product development and innovation, dealing with IP rights and that type of thing. What we essentially ask the institutions to do is to answer a set of questions based on those three domains, where we ask about all the topics that essentially make or break research partnerships. For each of those topics, we ask three questions. We ask, firstly, what are you currently doing and what do you currently have in place? Secondly, we ask them to provide us with examples of what they are doing so that we can see, you know, these are the kinds of practices that are happening within this institution. And then thirdly, we ask them about how they plan to make improvements over a 2-year period. And the reason that we do this is because ultimately, the only way to try and get to fairer research partnerships is to actually make changes. And so we found that we think this is probably the best way to do it. You can go to the next slide. So what the RFI does is it encourages the awareness and use of existing guidelines, tools, and platforms, as well as building new ones. So some examples of some of the tools that we've identified that show really good principles or really good ways of dealing with partnerships are, for example, the Canadian Coalition for Global Health Research, which has put together principles for equitable partnerships with developing countries. We recognize WIPO, which is the World Intellectual Property Organization, who has a lot of information on how to deal with IP rights. We are working with WAITRO, or the World Association of Industrial and Technological Research Organizations, which has put up a platform, an online hub, which is called Syra, which encourages institutions to look for researchers who have good ideas, and it helps with the collaboration process. So it helps scientists and institutions to identify people or institutions that they want to partner with. So, for example, you might have a researcher with a great idea, but who does not have the resources to be able to actually do something about it. And this platform allows them to find funding to work together with institutions that might actually have those resources and are interested in working on a project like their idea. An additional one is one that we recommend highly, and it's actually a Swiss set of guidelines, which is called it's the KFPE guidelines. So it's the Commission for Partnerships with Developing Countries, and their guidelines, Kuku, you can click next because it will pop up. It's a guide for transboundary research partnerships. And in this guide, they have 11 principles and 7 questions that should be asked every time an institution wants to get involved working with a developing country on research. And so these guidelines, etc., are really useful. They are useful in the sense that they provide a way to think about how your partnerships should be, what kind of aspirational sort of practices there are that one could try and work towards. Next slide. So recently, actually this morning, the UK CDR announced that they have also put together a set of principles in collaboration with others. And so these principles are also another new set of aspirational sort of things to try and work towards. If you press next, Kuku. They also produced an article that they put into the Lancet, that was published in the Lancet, where they speak about trying to strengthen global efforts on COVID-19 research. And this focuses on partnerships and what kinds of practices should be involved in dealing with low middle income country partners. So next. So if you see there the principles that they mention, these principles are really not that different to what has been identified before by others. Like I said, they are aspirational. The problem is, how do you get to these? How do you pragmatically find a way to make sure that you are sort of adhering to what they suggest? And so the RFI is essentially a way to operationalize adherence to guidelines, codes of conduct, etc. It's a much more pragmatic tool that actually helps you to identify, okay, these are exactly these are the exact practices that we use to deal with specific areas in research. And it's easy to sort of align them with these guidelines if you have a better idea of what to actually look for. So next slide. So what the RFI essentially does is it's actually a global learning tool. And that is what we want it to become over time as we get more and more institutions involved and more institutions telling us about what they're doing. So at the moment, what it asks institutions to do is to share policies, practices, and examples. And from these, we will be able to do things like aggregate analyses, which show us, in South Africa, most institutions, for example, have got material transfer agreements that they use. Most institutions have a policy in place for promoting the role of women in science, etc. What it will also do is it will allow us to make comparisons. So we would be able to look at, for example, different regions and be able to see, okay, in this region, for example, in North America, institutions have really good practices in place with regard to IP rights, for example. Whereas in Africa, that might not be the case. There might be a gap there, and that helps us to identify a need and an area for us to try and work towards addressing those problems. Also, over time, what we want the RFI to do once we have enough users is it will help us to start identifying what are the good practices that are in place. And from that, people will be able to for example, use some of the policies from other institutions to be able to guide their own thinking and their own ways of dealing with partnerships. And over time, what this will do is it will allow for systematic global learning about how partnerships are dealt with, how they are negotiated, and how they can be made more fair. Next slide. Oh, not next slide, sorry. So, for example, we had 3 institutions in Senegal who produced RFI reports. Unfortunately, only one has been published so far, but from those draft RFI reports, we were able to identify that none of those institutions had ever used material transfer agreements, which shows a massive gap for Senegalese research institutions. And actually, what the Ministry of Higher Education and Research was able to do then was to be able to say, okay, now we can approach one of our partners. So they approached the IRD in France, who was able to provide the template that they could then use to produce material transfer agreements that were fair and made sure that their best interests were also held in that. Next. Another example of how the RFI has been used is for the community of Portuguese-speaking countries, where they actually decided to adopt the RFI as principles or guidelines that they should be following within any of their research partnerships that they are involved in. And we actually do have that document on our website, but it's not in this slideshow. But essentially what it said is that they would adopt the principles of the RFI and follow RFI to make sure that their partners treated them fairly. Next slide. So there are a number of benefits to using the RFI for an institution. The first, there are internal benefits. So the first of these is that it promotes alignment with organizational values. Very often you'll have institutions in their mission, for example, for their mission for research, who will talk about making sure that they are involved in collaborations and that these collaborations are equitable and fair. This actually provides a pragmatic tool for making sure that you are doing that. And if there are areas where you're not doing it, it actually helps you to identify that that is the case. It increases research and development efficiency by making sure that you are training your staff, you are making sure that priorities for research are actually relevant and valid, that your research is relevant to the communities that it's being done on, etc. And it also improves the quality, cost effectiveness, and impact of partnerships. Externally, it creates clarity and transparency for partners and stakeholders. So, for example, if you have your own RFI report, and that way, when you are looking for partners, you can also ask others, you can ask your partners if they have an RFI report, and from that report, you would be able to actually see how they treat their partners. It creates fairness from the start. It attracts like-minded partners, so those who also want to make sure that collaborations are equitable and fair. It demonstrates responsible corporate or organizational citizenship in research and development, and it also highlights organizational innovation. Next slide. So at the moment, we have 10 institutions who have actually signed on to the RFI and who are either busy producing RFI reports or who have already published reports. So we have 4 reports that have been published up to date. One was published this year. So the Swiss TPH published theirs in, I think, March of this year. We have 2 RFI reports that are almost finished. One of these is from the University of Cape Town in South Africa, and the other is the Islamic University of Gaza and Palestine. And then we have a number of institutions who have begun the process of actually producing reports. And one of these is CAPRISA. But obviously, as I'm sure you all know, CAPRISA is very involved with the Ministerial Advisory Committee for the COVID-19 pandemic. And so they have experienced delays, but they are extremely supportive of our initiative. They believe that it is really important to be part of this. And so that is why they have signed on. Next slide. So the RFI, what's next? We have been working on a number of areas of trying to really bring the focus on equitable partnerships into place, especially since COVID-19 has hit, because we feel that it is hugely relevant now at this time, especially because there is so much collaboration happening around trying to find solutions. So one of the first things that we have been doing, and this was before the COVID-19 pandemic started, is we received a grant from the Botnar Foundation, which is based in Switzerland, to actually create a digital version of the RFI, which will allow institutions to answer the questions and produce their reports online. This makes it really easy. It makes the workload somewhat reduced. We have also changed the the format of it slightly, so it's a little bit more quantitative and so easier to answer. What this platform will also allow us to do is that as reports get uploaded, we can start doing analyses on them. We can start showing, what is happening around the world, what the trends are with regard to different practices. And it will also allow us to have a management system that we can use to try and make sure that when we get a large number of institutions involved, we can actually manage it easily on our side. We have also received a small grant from the Gates Grand Challenges Explorations, which is in collaboration with Emory University in Atlanta. And what we are using this grant to do is to actually use the RFI as a tool for trying to improve campaign effectiveness. So we are working with a number of partners on this who will be using the RFI on their health campaigns and then assessing whether applying fair principles for partnerships actually helps to improve the effectiveness of those campaigns themselves. Next slide. We have also been talking to the National Health Research Committee, or one of the head people there, who is interested in the RFI and is having a look to see how we could potentially use the RFI to help them to define the priorities that should be used nationally. The preliminary suggestion that we have for that is that the RFI could actually be very useful for them to mediate twinning between higher, or should I say, historically advantaged and disadvantaged academic institutions in South Africa. So what the government would like to do is to have an institution like WITS, for example, working with an institution like the University of Fort Hare to help them develop their systems and bring their capacity up somewhat. And then finally, as I said, we are trying to bring the RFI into focus as a tool for actually dealing with pandemics. And so we feel that equitable partnerships would make a massive difference towards increasing the resilience of countries like South Africa, like other African countries, to be able to actually have resilience against a future pandemic. Because we can see from what's happened here, it's a problem that we do not have the capacity, we do not have health systems in place that can manage something like COVID-19. And so we believe that the RFI is a tool that can be used to address epidemic number 2, which Carl spoke about earlier, which is a lack of contextually relevant research and making sure that capacities are built up over time. So Carl, I don't know if you want to add to that.
No, just go on. I think the next slide or so I should be talking.
Yeah, so next slide, Kuku. I think this is Carl's slide.
Oh, okay, yeah, thanks. So back to, a bit of the more generic picture. And I do realize that when I looked in the people participating in this meeting, that there might not be 100% kind of understanding of equity and equitability and fairness in research. So I just wanted to make one or two statements, and then I'll talk again to this particular slide. So when you are researching and when you are dependent on research grants, inevitably in many African scenarios, including in many of South African scenarios, the dependence is on a partner in a high income country who has the expertise and the money often to come down. And very often the way research granting works is that for example, the NIH or the European Union or Japanese health authorities, they decide on what money is going to be available for, then encourage competitive applications. And then the best kind of gets the grant. So very often that is a high income country. Once the grant is being given, they then look for partners, so-called in inverted commas, to implement much of that research. And I think that is where often then the problem comes in, because if the one comes and with the expertise and having the primary grant and the responsibility and not being able to share much of the decision making and going to countries to deliver on research promises that might not take into consideration that there are other things that could happen in that particular country or in that particular environment or population, then you get what we call a kind of a systemic inequity, a systemic problem in this. And the word systemic has been very difficult to make clear, but I think everybody who's been following the George Floyd saga in the United States and now understands the word systemic, as in systemic racism in that case, but now it is in systemic underdevelopment of some of the partners in the partnerships. So very often when we talk to good-willing researchers and highly competent researchers anywhere, it is often at a personal level that the relationships work very well. And so people say, what is this problem? Because we provide for capacity building, we have master's and doctoral training grants, we put all that stuff into the research proposal. So what is the problem? But the problem is that there are many areas that are not being covered by individual research grant. And that is what the RFI tries to do. So in particular interest, I think the equity in research would help to deal with all the aspects of research collaborations. And I think the example that Kirsty gave was very clear in Senegal, when we discovered that even the single highest HIV-2 research institution was working on a friendship basis and there was no material transfer agreement. So for years, Senegal has been giving away its potential access to future intellectual property on any stuff that was sent out of any biological specimen that was sent out of Senegal, because there was no agreement. And so there are a whole bunch of issues other than just the doctoral or the master's grant that sits into a grant. And we need to seriously look at all the key aspects of it. That is what the RFI tries to do. So create a systemic change in this. And it also works in two ways. It's not just about Africa or African countries or low-income countries who get the bad deal. In fact, I had a whole conversation yesterday between Kirsty, myself, and somebody at Johns Hopkins who was saying, well, your program looks very one-sided, and it's not only one-sided. When we come with all our stuff to a low-income country institution, there also has to be reciprocity and understanding that maybe specimens should leave the country because the best laboratory is available somewhere else. And so there is this inequity is not simply one way. It works in two ways. And so the second big thing that the RFI wants to do is to create transparency and trust in those relationships so that we actually can work together. The most spectacular example I think we had so far was that in 2011, I think that was the year, for example, every year in Asia, the influenza virus strains would be detected, they would be sent off to World Health Organization, and companies would make vaccines against the most likely winter flu epidemics that would hit Europe, the United States, and so on. But in 2008, sorry, I hear a Nakwanda. Who can please mute your mic, please?
Oh, I'm so sorry.
Sorry, yeah. So that in 2011, one of the countries in the what is now called the Far East, if you want, discovered the strain, but then didn't want to share it with the WHO out of fear that somebody else would make money of creating a vaccine. And that kind of suspicion and lack of transparency in international research makes it very difficult to discover anything. So the need for now COVID-19 global coalitions is basically also focusing around, yeah, we need to have that trust. Otherwise, the one who finds it will keep it, and it will be massive economic interest behind finding that first vaccine, et cetera, et cetera. So the RFI would try to help create a systemic improvement of transparency, quality, trust, benchmarks, and standards. And that is, I think, why I brought up this last slide, which came out of a newsletter from a very prominent US institution called the Council on Foreign Relations, which is ask the question and say, why is global health missing its moment? And maybe the next slide, Kuku, is a quote from this article where it says is that to our mounting horror, it says it is clear that technocratic knowledge has no sway without political will. And of course, they're speaking a lot about the United States. So the challenge is to drive change in a world that is uninterested in expert opinion. And you know, when Dr. Fauci and President Trump stand on the same panel, you can understand exactly what this is trying to say. And so they go, I think there is a next slide on this, if I'm not mistaken. Yeah, so basically you can read this while I'm talking, but saying that there is the essence of public health. And that's why we felt it's very important to bring this in this PASA and School of Public Health seminar, is the essence of public health. It is a mix, it is a collaboration between technocrats and politicians. Public health is not just technical, and public health is not just political. There has to be this collaboration. And from a distance, I think that South Africa is getting it very right to have that engagement between the one and the other. But as we are speaking to technicians and technocrats now in schools of public health, I think that that it is really important to get the technical basis, the training, the quality of the data. That is what needs to get right, and the capability to do research. And that is, I think, the link to the Research Fairness Initiative, so that if more institutions in Africa, but also in the North, and as you saw, for example, the Swiss have agreed now, one has already produced. The French Institute for Development Research, which is a huge institute for all non-health related development research in low middle income countries, have agreed to start this because they think it is crucial. So slowly it's becoming a North and South, so to speak, tool that helps to create this kind of ongoing, systemic, equitable relationships in research. And that's, I think, where I want to leave this and then open it up for questions. Kirsty, I think the last slide is for you.
Yes, sorry. So I just wanted to say that if anybody is interested in the RFI, you are more than welcome to please contact me. My email address is there. I'd be happy to share further information, answer any other questions that maybe are not asked here. So please feel free to take down my details. You're more than welcome to contact me.